Hey guys, this is Dr. Nicky and welcome to Surgeon Simulator 2013, the standalone version. This is actually brand new. It came out a few days ago. There have been a few people doing Let's Plays of this on YouTube, but they're not actually legit surgeons like I am. So we'll be going through the different operations today, and we'll be trying to get A++s because in the actual first version that came out, you get A++s no matter how terribly you did. Now it's actually pretty... Sorry, the phone's ringing, 1 second. Get out of here. Shut up. Sorry, my secretary's out today. Anyway, so you can't actually get A++s very easily in this game, so I'm going to be trying to do an A++ surgery attempt at heart surgery, double kidney transplants, and brain surgery. There have been a ton of other doctors, or actually fake doctors, trying to do this on YouTube, so I just thought I'd show you guys my credentials. I'm actually a legit surgeon. See, it says PhD. Oh, crap. Yeah, I'm actually a legit surgeon, as you can tell by this totally legit certificate. There's one on my desk, too. I've actually beaten this game. So I'm going to go ahead and try my best to do A++ surgery for you guys. Let's do this. Alright, we're going to start off by performing a basic heart transplant. Let's get this rag off the patient, see what we're working with here. I'm going to grab my bone saw tool, and we're just going to hack away at his ribs very slowly and precisely. It's important to not lose a lot of the patient's blood here in Surgeon Simulator 2013, the standalone version, because the amount of blood you have left is really important in getting a high rating. We don't just want to save the patient, we want to look like a complete badass while we're doing it. So, looks like I got the right ribs all cut up, going over these left ribs over here, and I need to make sure I cut as close to the outside of the ribs as possible, just so we don't have them in the way when I pull the middle section out. So we're going to go ahead and cut this last piece of rib here at the top, and almost got that. Come on, there we go. And now you see the middle rib cage is loose. I'm going to take that out, and we don't need that. Let's just throw that over there. And lungs, don't need those. Just going to get that out of the way. I didn't do a very good job of cutting the right side of the patient's ribs, so I'm going to kind of have to get under there and try to... Oh, there goes my watch. I have to get under there and pull that lung out. Come on. And luckily he has a breathing mask on, so he'll still be able to have oxygen circulating through his system. I'm going to grab a scalpel right here, and we're going to need to cut his uvula. I think that's what it's called. Actually, no, I know that's what it's called because I'm a legit surgeon. And we're going to make a small incision at the top over there. Make a small incision at the bottom now that that's taken care of. Looks like the patient's got a little bit of blood loss, but we're going to have to work quickly here. I think this is, yep, that's the broken heart right there. It's just going to get that out of the way. Let's grab the new one. Don't need to take out any of that other stuff. Just had to get it out of the way. Come on, grab the heart. And we're going to go ahead and drop that back in the middle, and surgery complete. Looks like that's 1 minute 44 seconds, 4,795 milliliters of blood left. Alright, looks like the previous patient not only had heart problems, but he also has broken kidneys. So we're going to go ahead and grab a scalpel, and let's see what we can do on his intestines. The kidneys are behind the large and small intestines, so we're going to have to remove this. I'm going to make a small incision in the bottom right of the large intestine, and in the top left, there are a few other incisions I need to make. The intestines will just go ahead and pop out on their own. Let's see if we can get that. Yep, looks like we got the large intestine out, and the small intestines are now out too. Let's get rid of that scalpel, won't be needing that. And that stupid beaker is always in the way. I'm going to try to stabilize the patient right now. It's important that he maintains a high blood level. And using this green needle, go ahead and poke him in the ear. Oh, there goes my watch again. By using the green needle, I'll slow down his blood flow, and the blood loss will go back to 0. So let's get these intestines out of the way. Get the last of this small intestine out of the way. And I think this is the large intestine. I might be getting that backwards, but I'm a legit surgeon, so it's whatever I want to call it. Then go ahead and grab this. Pull that out, and if you want an achievement, which I've already gotten, go ahead and sling that around his neck. That's a nice little scarf for him. That gets you an achievement for this game. Go ahead and try to grab this scalpel right here. Come on. I'm accidentally grabbing parts of the tray. Let's just go ahead and grab that one instead. And we're going to make a small incision in his upper stomach. I'm going to go ahead and get that out of the way. And I believe that's his liver up there. The ribs aren't too important. We can just work around those. It'll save us a little bit of time. Yeah, let's get that upper stomach out of the way. This liver you can actually just pull straight out of there if you're strong enough. So luckily I'm left-handed, and we can, come on, if I can get a grasp on that liver, we can just pull it straight out. Don't worry, the patient is under some anesthesia, so he won't be needing that, and he won't be feeling any of that pain. I'm going to go ahead and grab the kidney remover right here. You can tell it's a kidney remover because it's shaped like a kidney. Come on, stop. Stop. Okay, there we go. And now that I have a hold of that, we're going to need to make a small incision between the kidney and the kidney connectors. We get that out of the way. Now this is the hardest part of the operation right here. Kidney operations are just my least favorite. Going to go ahead and stop that 1 milliliter a second blood loss. I'm going to grab this plastic yogurt spoon. Hopefully my nurse sterilized this for me. If not, oh well. I mean, we're just here for a lack of blood loss and speed. Don't really need to be sterile. I'm going to use the spoon to get the kidneys out of the way because you can't reach down. This guy's got a really, really deep chest cavity, so it's hard to get the kidneys out of there just by grabbing them. Actually, I think it might be nearly impossible. So I'm just going to go ahead and, come on, get out of the way. We need to use this plastic spoon to get this last left kidney out of the way. If it would just work with me here. Come on. Come on. Don't worry. I'm a professional surgeon. I know what I'm doing. Yep, that looks good enough. Alright, let's go ahead and grab the right kidney. Oh, look. Oh god, I dropped the left one. Okay, hold on, hold on. Yeah, I have a little bit of problems right here. Gonna go ahead and reach off the side of the bed. Yeah, luckily that didn't fall on the floor. Go ahead and grab that and let's set that in place. And there we go. Kidney surgery complete. Alright, and I got called in early this morning to perform my favorite kind of surgery, a brain transplant. So we're going to go ahead and grab my skull removal tool right here and slowly chip away at the patient's outer skull. It's important that I don't accidentally touch his brain with this thing because then we would have some serious problems. I'm going to go ahead and slowly chip away at the outsides of the skull. That'll cause the insides to fall apart on their own. Looks good enough to me. So I'm going to go ahead and get a firm grasp on the patient's brain, try to pull it out. Looks like it's still solidly attached by the brainstem, so being the subtle guy I am, I'm going to go ahead and grab the tomahawk and remove the brainstem thoroughly. Yep, looks like a clean cut right there. Going to go ahead. We've soaked the new brain in some liquid water, and just going to go ahead and reach in the jar. Hopefully the nurse picked the right size. So we're going to go ahead and grab that and slowly insert it into the skull. Looks like a perfect fit to me. That's 46 seconds of brain surgery right there. That's why I'm an ace doctor. And that's how you do it. The 3 basic surgeries in Surgeon Simulator 2013 done A++ style. If you guys want to join us for the next video, which is the secret 7th mission, after I insert this floppy disk into the computer, go ahead and hit that subscribe button. That'll be up shortly, and there'll be an annotation on the screen when it's up. Thank you guys for watching. Leave a like and a comment if you feel so inclined, and I will see you all some other time.